going to do next is open up the blue folder.
We put 700 health science students, so students from 10 different professions, through a half-day interprofessional learning experience.
In that blue folder, you're going to find a patient case, and there's one copy for each of you.
We focus on a different content area, 3 different content areas throughout the year. The first one, which was today, was ambulatory patient safety.
And if we could take a couple minutes to read this patient case, then we're going to go through some discussion questions, okay?
The students get really bogged down in the content, and the content is important, but that's actually not why we're here.
Patient safety in general, like what are like key concepts that you want to like start changing?
It's really what they're doing in teams.
So that goes back to patient education.
What we're trying to do is just to start conversations, just to start relationships.
As long as you're spending a lot of time with them, communicating, and at the same time giving them what they need, then you've kind of covered your bases there.
Just to start the students thinking about the fact that that nursing student sitting across from me is a really smart person and they know something that I don't know. Wow, isn't that neat? To develop an appreciation for something. That's how you change culture. You don't do it fast, you do it really slow.
So if you guys could, on the count of 3, reveal your response and stick it in that little metal holder. All right, we got C's, we got E. I didn't know there was a response E. There really are no exact right answers to these questions, and you'll see that as we continue to progress.
What we've developed is a healthcare system that's unfortunately rather hierarchical in nature, and that hierarchical format doesn't provide optimal health outcomes.
The staff education, the lady answering the phone didn't really see that it was a big deal, so she just kind of brushed it off, and that was a pretty big thing too.
What we want is a flat, kind of horizontal healthcare system where everybody feels empowered to act on behalf of the patient, to work for that patient. Everybody feels empowered to call out an issue or to identify something that is a concern.
What I'll take with me from today's session is that everyone looks at problems from a different angle, and that everyone is willing to take responsibility for patient care at a different level.
I think one of the most important things is that the view that I have on health from a public health perspective isn't always the best view or the right view, even though sometimes I think that it is, because that's the field that I'm interested in.
Well, in the future, we're all going to be interacting with each other, and it's helpful to know what different specialties think about certain issues, and for them to know what we think.
It really is a team effort to offer somebody good health care. You can't be just individualized systems. It has to be interconnected. That way we can give people the best care.
Know that all providers include nurses and doctors and pharmacists and all of that different spread, but I still kind of had in my mind that provider was physician, and that's not true. Provider is everyone together, so it definitely was kind of smacked in to be concrete today.